everybody. This is David D'Arcangelo, Global Marketing Director, CTFO. I have one of my favorite people who is a member of our scientific advisory board, is the doctor behind the doctor formulated in our 10XPure multivitamin and mineral supplement, Dr. Robin Sika. How you doing, doctor?
I'm doing great, thanks.
It's always nice to see you. I just want to point to a little bit of your background because I think it's so impressive. I'll just read a few of the things, but along with the many accolades, Dr. Robin Sika is a sought after medical doctor that practices, several alternative therapies leaning towards nutritional therapies that treat the whole body. And one of your biggest goals when you formulated the 10XPure multivitamin was, David, we need to formulate it in a way that your body can recognize those nutrients and they can use them, that they get to their destination. And your background is, if I go down, everybody, just a few more: American Board of Integrative Holistic Medicine, American Board of Clinical Metal Toxicology, which is a show unto itself. We could talk all day on that. Is a CBD expert. How many doctors do you know that are CBD experts? And Innovative Approaches Holistic Health. So welcome. And I know you've been busy.
We've had a busy 2 years.
2 years. Things have changed a lot, but I would just say that your background, since you cross over, you're not the traditional, here's where I practice. You've gone out and become an expert in different areas that I would assume are very attractive right now for the average patient.
Absolutely. I mean, nobody is talking about how do you support your immune system. And yet that's what people are really interested in. They're interested in prevention. They're interested in, getting their reserves of their health up so that they're more resistant to any kind of illness, whether it's a chronic illness or whether it's an infection, regardless. I mean, that's what people are interested in. But what I've seen, the conventional medical trend has been to do less and less, like less and less treatment, less and less, certainly no nutrition or, guiding people in lifestyle or detoxification or any of that. They're getting more and more narrow in their approach. And, my approach keeps getting more and more expanded because, I always say the basis of health is like you have a certain amount of reserves in your system, and that's kind of dependent on how good your nutrition is and whether you're adequate in various vitamins, minerals, essential fatty acids, hormones, et cetera. And then the number of stressors that are coming at you. And of course, it's been a stressful year, not just emotionally for people, but physically as well. And a couple of years here. And, and that puts more of a stress on your system. And when there's the stress level outweighs your reserves is when you get sick. Okay. I'm not just saying with an infection, it could be a heart attack or it could be, depression, or it could be whatever your tendency to develop that illness. So in my field, what I try to do is I look at what are all the stressors that we can pull off the system and deal with. How can we relieve those various stressors? Could be a heavy metal, could be environmental toxins or allergies, what's going on in the gut, whatever, infections in the gut. You get rid of those and then you build up the reserves. And I love the multivitamin because that's kind of just the first building block. The first building block is make sure you have good nutrition. And that's why I was pretty adamant with you about we have to have bioavailability. We have to have
wait a minute.
That they're going to get into the body and the body's going to be
everybody watching this has to know you fought for them. When they take this product, they should be thankful for you because, we took the task, one of the biggest manufacturers in the country, and you laid it out, and they had to run around. They weren't used to dealing in such a, really laser beam. You had specific, items. And I just thought it was amazing because ultimately we came out with what we believe is the best product on the market. We believe that there's a patented delivery system. And I know you love 10XPure because if it doesn't get to its destination, then it's all for naught anyway.
Right. You're paying for it and it's not getting absorbed. And there's so many nutrients that are poorly absorbed. We know CBD is only about 6 or 10% absorbed unless it's combined with something that makes it like 10XPure that makes it more bioavailable. Same thing with curcumin or a lot of different herbs. The vitamins, if they're not minerals, if they're not in a chelated form, your body may just not be able to absorb them. And I would love to see studies, and I know they're expensive but I'd love to see like how absorbable the different nutrients are when combined with 10XPure, because we know that 10XPure is going to make it, the way the molecule is, it gets that across the cell membrane that much more efficiently.
Yeah. Before we got on, I just looked back and did a little bit of research. It's estimated that over 50% of the population in the United States spent approximately $31 billion last year on supplements. Mm-hmm. And the question which it's all driving to, and down at the bottom there, it's really how much survives and gets to its destination, isn't it? Isn't that the $1 million question?
Absolutely. That's where the rubber meets the road. Because if you're taking, like, for instance, iron sulfate. So people go to a drugstore and they get iron sulfate, which is not a chelate, and they start taking iron and they're getting 5% absorption, and it's causing all kinds of GI distress because it's not being absorbed. Whereas when you put it in the right chelated form, then all of a sudden you get better absorption. And that's true of magnesium and all the minerals that I made sure they were in chelated forms in the multivitamin.
Yeah, so let's take the next step here and let's go walk through them. And there's different stories and anecdotes, which we'll go, and we've done this before. It's each liquid soft gel contains essential vitamins and minerals, and Dr. Sika made sure that your body could recognize these ingredients. What does that mean what should people think of when I say that your body can recognize them? What's the benefit?
Well, again, if your body can't utilize it in the form that it's in, then it's got to exert energy to convert into a form that it can utilize.
Right.
Or it may just not absorb it at all. It may just not utilize it at all and just excrete it on out through the body, through the system.
So that $31 billion that people spent last year, probably do they get most people without 10XPure? They're taking other vitamins. Could they get as little as 10%? I read.
Yeah, or less on some.
It's just, so it's not what you buy; it's what your body gets delivered to the destination.
Correct. Yeah, that's really, and it's all about quality control in supplements. People, and I've been, for the last 36 years in practice, I've been so on it about you have to use this brand or this, this form, because otherwise, you're not going to get the result. You're not going to get the result if you're not using quality controlled products,
right. So let's talk about a few that for your immune system. You wanted vitamin A, vitamin C, vitamin D, correct?
Correct.
And then we started there, and then your cardiovascular system and your thyroid gland. We use selenium, and I know you have your favorites, but let's just talk about maybe one of mine, one of your, cellular energy production. Which I believe is life itself. You wanted vitamin B vitamins, thiamine, riboflavin, niacin. Give people a little background of what's important here.
So the first thing I'm going to go is back to that first bullet point, because A, C, and D are really, really important. The other one is zinc. And there is zinc in the multivitamin mineral. Because I've been sounding like a broken record the last 2 years with all my patients. Make sure you have adequate D, C, and zinc, and and A. You've got to have enough of that. And as a result, my patients, and most of my patients are have chronic illnesses or have poor immune function. And honestly, if anybody's gotten sick, it's been pretty mild. So, it's been great. Remarkable. My practice has stayed healthy, in the last 2 years.
Great.
And it's really, Vitamin A, probably, I don't know, I can't remember the exact amount that's in the multivitamin, but like the
Yeah.
C, I tell people to supplement extra just because, you need extra. And if you get sick, you definitely want to take like a lot of vitamin C, like even 1,000 milligrams every hour. Vitamin D, I actually have people measure blood levels because I want that blood level between 50 and 100. There's over 10,000 studies on the health benefits of vitamin D. It's all on
PubMed.
no, not on PubMed. In
Yeah.
fact, most nutritional literature is not on PubMed. It's not in the medical literature. It's in the scientific literature, which is a much bigger body of science.
Right.
The scientific literature. PubMed is just the medical literature.
Right.
And so you miss a lot of these studies, but there's a great site called Vitamin D Council that has compiled all the studies on vitamin D and the benefits. The ideal range is 50 to 100. I use Quest Lab, which is, national,
Sure.
and their reference range is 30 to 100, but you really want to be up in the upper end of that. So it's a good idea to get your levels checked. And if people don't have access to a doctor like me that will order those labs, there are, Life Extension will order them, or, Durham Health Labs. There's a bunch of different places that you can go that you can order your own labs, and get that vitamin D level, because there's literally dozens of studies from going way back in the beginning of 2020 where they were tracking hospitalized patients who were very ill with infections, and all of the patients who were hospitalized or on a ventilator in the ICU had a vitamin D level below 30.
Wow. Everybody listening, just the wealth of knowledge, Dr. Sika, I love the conversations with you. Just these solutions that Dr. Sika formulated in the doctor behind the multivitamin, you get with the 10XPure delivery. So everything you're talking about is critical. Take me to selenium.
Well, selenium is an essential cofactor in a bunch of different detox pathways, and it's an antioxidant. It's really important for with iodine for thyroid hormone production, and thyroid disease is practically epidemic these days. And having a low thyroid actually also affects your immune system. People that have hypothyroidism, if it's not treated properly or it's not diagnosed or recognized properly, tend to have more infections, tend to have more, get sick, all the colds and flus and things all the time. And they also develop more heart disease, more cancer, et cetera, because their immune system is not as strong. So selenium is another one that's really, really important in there because of the thyroid. And for cardiovascular health as well, for preventing aneurysms and things like that.
Now, I know on cellular energy, I mean, we have a lot of these different ingredients, but pick out a few. Why is cellular energy so important?
Well, the mitochondria in your cell is like the motor of your body, the little tiny motors that are running and producing energy. And if you don't have energy, nothing gets done. Your immune system requires a ton of energy. Your digestion, your brain requires a lot of energy to function. Your heart muscle needs a lot of energy. There's tons of mitochondria in the heart muscle. And many of these B vitamins are actually the cofactors that run that mechanism in the mitochondria. So if you're deficient in those, you're going to tend to run low on energy, and that's going to have impact throughout every system in your body.
And that's where people go, is like, if you're tired later in the day or earlier in the day or early evening, or you just find yourself as you age not having that energy. Isn't that one of the possible or potential challenges, is they're not getting the right ingredients into their cells so that the mitochondria can have the nutrients to produce the energy that it needs to produce, correct?
Exactly. And, just for instance, B12 is one of the hardest nutrients for the body to be able to absorb. It's kind of a really complicated mechanism. And as you get older and your body produces less stomach acid, you absorb that much less. So one of the first things, if I have somebody coming in with fatigue, B12 and folic acid are the first, in the first set of blood tests that I do to assess that.
Yeah.
what's going on. And oftentimes I find just a low B12 level, and given more B12, or giving it in a different form. Like sometimes people have to do it by injection because they don't absorb out of their intestinal tract. But that's really critical. And I want to make a point about the folic acid, because the form that is in, and you and I talked about that a lot. The form of folic acid that is in
methylfolate, if I remember correctly.
Methylfolate, because over 40% of the population have a genetic variant called MTHFR, and that means that they have a harder time methylating folate and B12 to be able to utilize that in their, in various areas in biochemistry, and that affects homocysteine levels, which is a potent cardiac risk factor if your homocysteine is high. So if you're not getting the right kind of folic acid and you're prone to that, you could have a high homocysteine that damages your heart and your blood vessels. Also, it's really important in terms of metabolism of neurotransmitters, as well as steroid hormones. So imbalances in steroid hormones and imbalances in neurotransmitters, anxiety, depression, all those kinds of things can be affected if and you might be taking a multivitamin that has folic acid in it, but it's not the right form. And then those systems can't work if you're not getting that methylfolate.
I have to tell you, Dr. Sika, that this is the most potent and powerful conversation interview you and I have ever had. You're so succinct today, and I just want to tell you, we haven't done this in a while. It's a pleasure. The people listening, watching, when you think about that vitamin, the multivitamin you formulated, this is what you're taking, is what you're talking about. This is not a theory. This is like from years of experience, and this product is available, and you are taking it. Hopefully, if you're watching, and if you're not, you should get it. So I just can we jump a little bit? L-theanine, one of my favorites. I like to combine it with coffee because it takes kind of it modulates my caffeine.
Caffeine buzz.
Now, I'm not sure that has any health benefits, but that's what it does to you.
But it feels good. I mean, I think everybody, I talk about this all the time, because people come in to see me, and everyone's got their story of what happened to them in the last 2 years and how stressful it was. So anything we can do, the theanine, the ashwagandha that's in the, I'm sorry, I'm blocking on the protein. The CTFO's protein powder, I'm blocking on the name of it.
Oh, it's it's
the ultimate shake. Is that the
ultimate,
one?
The ultimate shake.
That has ashwagandha, so theanine and ashwagandha really calm down your nervous system and calm down that overproduction of adrenal hormones when you're under stress. So it's really important, because it allows you to function in this kind of crazy environment that we're all, just trying to pivot and deal with the best that we can,
So what happens is, if you're lacking, right, and you have stress and you're bad eating and your lack of sleep, I mean, all these things just compound it correctly and make it worse.
Oh, absolutely. That's why I like to go back to that, what I call the threshold phenomenon, that if you're not dealing with the foundation of, diet, lifestyle, basic nutrition, and then looking at how your body's being affected by different things, it's very easy. A lot of people just got stressed out and started stress eating all kinds of, foods that are, not the healthiest, gained some weight, and all of that stuff just puts an additional strain on your body. A statistic I've been mentioning a lot lately is that for every pound of weight that you gain, your heart has to pump another mile of blood vessels.
Wow.
So think about the people that have the COVID-20 or whatever that they picked up along the way. It's time to lose that, because it really is affecting your more than just, how you look in clothes. It affects your heart. It affects everything.
So I just put another page up, and we can bop around a little bit here, but we've talked about the B12 a little bit, brain function, vitamin D3, a little bit magnesium, calcium. One of my favorites is vitamin K. It's one of my favorite nutrients, and I think that it's one of yours as well. And maybe it became mine because you told me about it so much that it was so compelling. So can you tell us a little bit about vitamin K and maybe touch on a few of the others?
Well, vitamin K is really a fascinating nutrient because it's like nobody's ever heard of it, or until recently, nobody ever heard of it. But there's, again, tons and tons of studies on it. It takes calcium where it shouldn't be and puts it where it should be. So if you have calcium in the lining of your arteries, it'll take it out of there and put it into your bone where it should be.
Right.
If you have metastatic calcium, like I've seen people that have like really bad arthritis in their fingers where they have swelling in the joints, the calcified swelling in the joints. It takes a long time and it doesn't happen quickly, but it'll start to move that calcium out of the arthritic joint and into the bone.
Wow. Amazing.
So yeah, it's been called the life extension vitamin, actually.
Wow.
So it's a pretty powerful vitamin. And again, it's, a lot of people take vitamin D and don't realize they need to take the vitamin K with it to get the calcium to go to the right place. And you need the whole form of vitamin K, not just K1 or K2. You need all of them.
Right. Yeah. So when I did the research early on back in when we formulated the vitamin, I would read about vitamin K and K1, K2, and it had all kinds of benefits. Vitamin K, people apply it to their skin to remove spider vein. I was bruises, scars, stretch marks, and I was just like, I'm constantly amazed at your body and how it adapts, how it relates to different ingredients like this. I was biking one time a month or two ago, and I fell and scraped my whole arm, and it was just raw. And a week later, it was healed. And just to me, it was just like, that's the miracle of life. If you're providing your body with the proper nutrients so that it can perform, it's like a car. If you beat up your car and you don't take care of it, it's not going to perform when you need it. And so vitamin K, et cetera, you remind me of that story, and you see it every day in patients.
Well, I think it's really true. And I always say, I never cure anything. I just help set up the right conditions so that the body will heal itself, because the body does the healing.
Yeah. Body does the healing. You have to you have to fuel it correctly, like your mitochondria for energy. You got all the different nutrients in here. So if you're lacking the nutrients, you can't perform at the highest level.
Right. Exactly.
So I'm just gonna see if you agree with this statement. It's not the cost of a bottle of vitamins that matters. More importantly, it's the amount of nutrients that enter your bloodstream for delivery to the target area that makes all the difference in the world. Right or wrong?
Absolutely correct.
Yeah. And so that when you take the vitamins, it goes into your stomach. It dissolves and it goes gets into your bloodstream, correct? And how can you just describe that process a little bit for people so they understand?
So there's a lot of barriers that those nutrients have to cross to get to where it's going. Okay.
Right.
We think about it, it's in the small intestine that most of these nutrients get absorbed. So it's got to get across that barrier. That's a barrier to the outside, like your skin. It's no different. So the body's kind of guarding and it has to pick up, like minerals, for instance, have to be pumped across by active transport. Okay. To get across. The nice thing about 10XPure is that it's actually easier to get a fat soluble substance across the intestinal barrier than it is some of the water soluble things like B12 or minerals, are actually harder. So that's going to aid that process. The body's got to pick it up and exert energy literally to pump it across that barrier and into the bloodstream. And then of course the heart's pumping all the time to pump your blood around to deliver it to each one of your tissues throughout your whole body. And then it's got to go through the blood vessel lining It's going to go
Wow.
into the cell, across the cell membrane, which is another barrier. It's a lipid bilayer, so it's got to get across two layers of lipids to get into the cell. And then if it's got to get in the mitochondria, there's a mitochondrial cell membrane also, or mitochondrial membrane that it has to cross.
Well, no matter, before this vitamin, I'd go to the warehouse club and I'd get the cheap vitamin. No wonder I felt anything. And when you formulated this vitamin, we all started taking it. We just everybody feels better. They feel better. They have the energy, they have some focus, have some confidence, but you just function better. And in that story you just told, you were so adamant about make sure that we have chelated minerals. Is that the reason so that your body gets to use them and they really sees the benefit?
Absolutely. If you look at magnesium oxide, magnesium oxide's fine. If you're constipated, it's going to help with that because it doesn't get absorbed. It's just going to float out. Okay. That's not it. It's just magnesium and oxygen, and it's a very small molecule. Okay. And it doesn't get absorbed at maybe only 5% absorbed. Okay. So you're taking, and most vitamins, if you look at most multivitamins, they cheap out and they go with magnesium oxide and calcium carbonate. You're not going to get any of that absorbed or very little of it. Yeah. When you attach a bigger molecule like an amino acid or an organic acid to this tiny little mineral, now you've made that more accessible to the body to latch onto, and then by active transport, bring it across the intestinal barrier. Okay, the body can grab onto it easier. It's like it's got a handle. It can grab it and pull it in. Right. Way better when they're chelated.
Oh wow! It's just people don't understand is that taking a vitamin doesn't mean you get the vitamin. You get the benefits. It's just what you're describing is that there's a war going on down there, and unless you have to stand a chance, you have to have very specific nutrients in a very specific form. Correct?
Right.
Okay. If you do, like I like to say to people, and the line I put up at the bottom is, when you have everything right and the right nutrients at the right times, you've never allowed yourself to feel this good ever. So Dr. Sika, I really, really appreciate you. And I want people to know we've done this before on a recording. It's on a video on the website. Send your clients there, send your customers there, send everybody there. But Dr. Sika is there. We've did a professionally recorded video, and it goes through a lot of what we went through today. I love today's interview. I am gonna get copies of this one, and this one will be up in the company's website. It's just amazing that we have you on our scientific advisory board. You're the most knowledgeable, the best in your field. And I just want to, on behalf of everybody watching, who watches you now or in the future of this video, this playback, thank you.
Oh, you are so welcome. It's a pleasure to work with you guys, and your products. You've taken the extra care in all of the products to really make them top notch, and I really appreciate that because I've always, like I said, always been about quality control, because that's how I see my patients get better. Yeah. They go to the drugstore or whatever, and they buy some cheap multivitamin or some cheap whatever, and then I can't guarantee the results. I can't. If they take the wrong magnesium, I can't guarantee that they're going to get the same benefit on preventing their migraine headaches or their muscle spasms or whatever other, issue is going on. It's very specific. And that's why quality control and understanding the biochemistry makes all the difference in whether a supplement works or not.
Well, thank you again. And for those of you out there, you see at the bottom of the screen, we just instituted one of the best smart ship programs in the industry. It's how you get the biggest discount on the product and get the product delivered on a regular basis. So what I always like to say, Dr. Sika, is smart shoppers, always smart ship to get the best value for their money. So thank you, Dr. Sika, and everybody. We really appreciate Dr. Sika. She's a gem, and we're happy to have her on the team. So good night, everybody.
Thanks for watching, and don't forget to click the link below in order to find out more.